Good afternoon, everybody. Thank you so much for spending some time with us at the Hawai'i State Center for Nursing for our webinar on the new graduate RN workforce in Hawaii. I'm Carrie Oliveira. For those of you who do not know me, I am the nursing workforce researcher at the Hawai'i State Center for Nursing. It's my job to collect, report, analyze, interpret, and present on data that we collect about the nursing workforce in Hawaii. It is a delight to do this job, and I thank you so much for spending your lunch hour with me. We are recording, like I said, so we will make a recording of this presentation available. If you have colleagues who missed it, we'll make sure that we get the link out to everybody. Before we get into the actual content, we are offering continuing nursing education for this presentation, so I gotta do some of that informational stuff. So the Hawai'i State Center for Nursing is accredited as a provider of nursing continuing professional development by the American Nurses Credentialing Center's Commission on Accreditation. The Hawai'i State Center for Nursing designates this activity for a maximum of 1.0 contact hour. If you are participating today on our live webinar, in order to receive continuing nursing education, you must claim credit commensurate on the evaluation with the amount of time you actually spent participating or attending the activity, and you must complete the evaluation form. More information about that will be available at the end of the presentation. If you happen to be watching the recording, the enduring recording of this presentation, the recording will be available for continuing education through December 31st of this year. You must watch the entire webinar and then complete the evaluation. The evaluation will be available with an association with the recording. Because this is a non-clinical subject matter, it's about workforce, this activity is exempt from identification, mitigation, disclosure, or the disclosure of relevant financial interest for speakers, faculty, or planners. All participants should have received a disclosure sheet or an information sheet via email prior to the start of the webinar. And if you're joining us by phone number that was not provided on your registration form and you would like to receive the C&E evaluation at the end of the presentation, please email us at hscfn@hawaii.edu and we will make sure we get that evaluation link out to you. I have two primary learner outcomes for today. They're not lofty at all. If I've done my job by the end of the presentation, you'll be able to describe some of the educational and demographic characteristics of the new graduate RN workforce in Hawaii, as well as describe the new graduate RN job market in the state. We will, by the way, be doing some polls throughout the presentation. They'll pop up, just answer the question. We appreciate your participation. Also, we will have time at the end for Q&A. So if you have a question at any point, go ahead and drop it in the chat. I'll address them at the end. So I appreciate your participation. All right. So I want to start with talking about why we need to talk about new grads. New grads are probably the single most asked about subset of the nursing workforce in the state of Hawaii. We get more questions about new grad RNs than we get about anything else. And we get questions about all kinds of things. People are really interested in new grads because we have a very constrained educational environment in the state. We want to make sure that we're supporting our new grads and getting jobs. We want to make sure that the clinical and availability of clinical education is appropriate and commensurate with the number of new grads we need to provide. We want to make sure that we're retaining our local students so that they can support the local workforce. So there's a lot of reason that we should be worried about new grads. The trouble, though, I have with some of the questions and sort of assumptions that folks come to us with are that there is a singular truth about the new grad workforce, which may or may not be consistent with the entirety of the data that we have about new grads. So my primary aim today is to make people aware that Waikiki, if you're standing on Waikiki Beach, perspective matters. If you're standing on Waikiki Beach with your back toward Waikiki, all you see is a big, giant expanse of big blue ocean. And it is an accurate statement to say that all you're seeing, all that there is big blue ocean. But if you do a 180 and you turn around and you take an even slightly different perspective, you see something different. So I appreciate that every individual in or around the nursing workforce has a unique perspective, is absolutely valid. My request today is that you bring whatever perspective you have and allow yourself to turn so that you can see the fullness of the data that we have about new grads so that we have a more comprehensive and shared understanding about what's going on with the new grad workforce in the state. All right. Before we jump into some of the findings, I want to talk about where our data came from. There are two primary sources of data for this presentation. We also have a report, by the way, that we released about the middle of last month. It's all, well, I'm showing you some of the data from that report, but there's more data in the report. But the two primary data sources are the Hawaii Nursing Workforce Supply Survey. If you're not familiar with the Workforce Supply Survey, it is something that we collect on a biennial basis with we could not do it without the Board of Nursing and the Professional Vocational Licensing Division of DCCA. So nurses complete this survey in conjunction with relicensure in every odd numbered year. The other data source we're using is the Hawaii Nurse Education Capacity Report data from 2019-2020 academic year. I'm currently working on the report for academic year 2020-2021. But because that report's not finished or released, we're using the data from 2 academic years ago. The patterns are generally the same and make a compelling enough point. So that's what we're working on. That's what we're using. Also, I want to help you understand what we're talking about when we talk about new grads. From a data analysis standpoint, we took a 5-year span. So anybody who graduated with their RN from their RN education program between 2021 and 2017. So it's a 5-year span. It's actually a 4-year span because we had almost no graduates from 2021. And the reason we look at 2 cycles worth is because the number of people we have to analyze data for in any 1 2-year cycle is too small. So in order for us to draw stable conclusions, we take a 4-year span. In order to be counted as a new grad for the purposes of analysis for this report and presentation, we're looking at individuals who completed their RN education anywhere. It doesn't matter, it doesn't have to be in state or out of state, but there are some analyses we did for only local graduates. Between 2017 and 2021, they live in Hawaii and they work in a license-related primary role in Hawaii. So they may not necessarily be in bedside nursing, but they're doing something that's relevant to their license. So we're excluding people who are like, bartenders or flight attendants. So that's who we're looking at. Okay. So the way we arranged the report is that we wanted very specifically to address some of the common questions we get. Ordinarily when I write a report, I, organize it in such a way where here's information I think you ought to have, and then you have to sort of sift through it to get the answers to the questions you actually have. We decided to take a much more direct approach with this report and just answer the questions we commonly get asked. We thought it was a more efficient presentation of the data. So one of the very first common questions we get, and that's kind of easy to answer, is how many new grads are in the Hawaii workforce and where do they work? So before we get to talking about the data that answers this question, we have a poll. So the first question I want to ask you is how many prospective RNs graduated from local ADN and BSN programs in academic year 2019-2020. Your answer choices are 260, 320, 400, and 430. Amy, if you'll throw that poll up for me, I'd appreciate it. So you should have a poll coming at you momentarily. Unless we broke it. Amy and I were testing the poll earlier. We may have broken it. Amy, is it working? Oh, there it is.
I just launched it. There you go.
Thank you. Okay, so go ahead and put your answers in. I'll give everybody just a few seconds to submit your best guess. This is just ADN and BSN local graduates. So in about 5 more seconds, we'll stop the poll. Excuse me. Okay, Amy, if people have stopped submitting their answers, let's go ahead and see what the results were. Whoa, lots of variation. This, I feel very validated in giving this presentation because most of you were wrong. In fact, the correct answer is 400. So some of you underestimated, most of you underestimated actually. So we have about 400 RN students coming from ADN and BSN programs. This does not, by the way, include RN to BSN students who didn't enter the workforce before continuing. So imagine a student graduating the ADN program at Kapiolani Community College and then immediately going into Manoa's BSN program without entering the workforce. So they contribute a small addition to the workforce, but we have no way of figuring out who they are. So I needed to acknowledge them. And then the reason I didn't count GEPINs, the graduate entry nursing program students, is although some of them remain RNs, they're highly specialized. The ones coming out of the GEPN program in Hawaii are advanced population health nursing RNs, and so they're going to work in a very small, narrow area of the RN workforce, and they're not competing in general with the other types of jobs that regular other RNs are competing with. So this is how many we're producing. The question is, where are they working? So altogether, when we look at the entire nursing workforce, about 11%, so just over 10% of the entire RN workforce in Hawaii comprises recently graduated students. And this is, again, from whether they were locally educated or not, they just graduated since 2017 or later. You'll notice, though, in the bottom graph here, and when we send the evaluation, by the way, we'll send the slide deck. So if you're having trouble seeing some of these percentages, I'll make sure that you get access to those data. But new graduates are slightly overrepresented in long-term care. So this is the long-term care bar here. And you can see that about 19% of the long-term care post-acute setting is employed by new graduates, whereas it's about 10% in every other setting. So we do see a bit of an overrepresentation of new grads in long-term care. This is challenging for long-term care, and we're going to talk more about that as the presentation goes on. But in general, this is where they are. When we ask about where we need to support new graduates, a lot of times we talk about new graduate nurse residency programs. Overwhelmingly, those are available in hospital settings. They have resources to provide new graduate nurse residency programs. But the fact that we have an overrepresentation of new graduates in that long-term care post-acute setting would seem to suggest that we need to figure out a way to enable our long-term care facilities to provide those systematic transition to practice support through NRPs, because it matters. I'm going to show you how much it matters here later in the presentation. Okay, so that's just, like I said, it was a simple question for the first one. How many RNs are there in the workforce and where are they working? There's the answer. 10% working largely in long-term care. So let's move on to our second frequently asked question. Are there jobs for new grads in Hawaii? If so, where are they? All right, so we're gonna, before I get into the answer to that question, knowledge test for you. New poll question coming up. What percentage of new grad RNs, and this is only locally educated new grads, so new grads from the 8 nursing schools in Hawaii, got their first nursing job within 6 months of graduating? And this is a job that requires their nursing license. Is it 25%, 35%, 55%, or 65%? Amy, if you'll throw that poll up for us.
Carrie, what's the time period here?
I don't understand the question. Ask me that differently.
2020 to 2021?
All of the new grads in our supply data. So anybody who graduated between 2017 and 2021, what percentage of them, when they graduated, whenever that was, got their first job within 6 months of graduating?
Got it. Thank you.
You betcha. Great question, by the way. Thank you. Okay, we'll give you guys just a couple seconds to answer that question. Okay. Amy, let's see the answers. Again, I love that you guys don't know the answers to these questions. It makes these webinars so worthwhile. It is, you guys, okay, so 30% of you got the correct answer. It's 65%. So 65% of anybody who graduated between 2017 and 2021 got their first, and again, this is just local grads from local schools, got their first job. And these are only ones working in Hawaii within 6 months of graduating. This, by the way, includes the time it took them to take and pass the NCLEX and actually get their license. Now, I got to acknowledge that for about 45% of new grads, this took about 3 months. We know, though, that since the pandemic started, there are licensing issues with PVL, and it's taking a curiously long time to issue licenses. I don't know to what extent that's affecting new grads as well as licensees by endorsement. So it could be that in our next round of supply survey data, we're going to see this time period change by virtue of licensing. But right now, licensing doesn't seem to be a barrier for the folks in our survey. So about 2/3 of local grads employed within 6 months. To me, that sounds like there's an ample opportunity for a locally educated new grad to get a job. We're going to talk more about where those jobs are here in a second. The problem, though, is that a lot of the jobs that where new grads want to work is not where the jobs are. So in 2021, when we put this survey into the field, I was curious, where do you want to get your first job versus where did you actually get your first job? And this, I don't think, is too terribly surprising to anybody, but 75% of new grads indicated that they wanted their first job to be in an acute care hospital. 75%. I don't think anybody expects that hospitals could hire 75% of our new grads. That's 75% of 400 new grads coming out of our local programs. Whereas in comparison, this is so the first bar in each set is the percentage of new grads who wanted to work in each setting. So we have acute care, long-term care, only about 4% of our new grads wanted to work in long-term post-acute care for their first job. You'll notice that there's a significant mismatch between the desired bar and the actual bar for both of these settings. So while 75% of new grads wanted to get their first job in a hospital, only about 31% did. In comparison, in long-term care, only 4% of new grads wanted to work in post-acute long-term care, and 35% of them ended up working in a post-acute or long-term care facility for their first job. This has implications for job satisfaction, which has implications for retention. When you go into your job search looking for a job in a specific setting, and then you decide, okay, I can't find the job in the setting that I want because clearly there's an enormous amount of competition for a very limited number of jobs in hospitals. So I'm going to go work someplace else, but it's my fallback job. You walk into that job expecting that you're not going to be there for a very long time because it's not where you wanted to work to begin with. This creates instability in the long-term care workforce. So the question is two things I think we have to start having really candid conversations about when we do workforce development. One, why? Why do new grads, is this an expectation they have? Why do they want to work in hospitals? We know that there's differences in the practice environments between long-term post-acute care and hospitals. You have fewer patients per nurse in general in hospitals. You have formalized transition to practice support. So those two characteristics unto themselves probably influence people's desirability to work in hospitals versus other settings. But I tend to subscribe to the belief that there's just a misinterpretation among a lot of students that about where the jobs are. So if you expect that nursing is done in hospitals as opposed to other settings, then it makes sense that that's where you would want to work. So I think that there's work to be done too about, can we address some of the challenges about working in long-term care? And also, can we do a better job of managing new grads' expectations about where the available jobs are and what the importance of the value is in working in these non-acute settings? So I think this is something we need to continue to pay attention to. Almost inevitably, when we provide data about the fact that no, there are in fact jobs for local students in local facilities, we get asked the subsequent question, but they're not in hospitals necessarily. We get asked the subsequent question is, well, why don't hospitals want to hire new grads? This is also something we need to start talking about. So another knowledge test, our third poll question coming up for you. This question is about the whole workforce, not just new grads. What percentage of the entire RN workforce reported to us that they worked in an acute care hospital in 2021? 39%, 42%, 51%, or 62%? Amy, let's see poll number 3. Okay, let's take a few seconds. Go ahead and throw your answers up there in the poll. Okay, Amy, let's see those results. Yay! The majority of people got this one right, or at least it was the most commonly reported answer. The correct answer is indeed 42%. This is important for us to be having a conversation about. So if you compare this to the national, there's still plenty. If you look at the country in general, the majority of nursing care is still happening in hospitals. I was a co-author on this paper that's cited here. It's the National RN Sample Survey. That was a collaboration between NCSBN and the National Forum of State Nursing Workforce Centers. So 57% of the nurses represented in that study are working in hospitals. So clearly there's a majority still in the country. Hawaii is not consistent with that. So in Hawaii, we have one of the most highly insured populations in the country, right? Medicaid coverage varies state by state, and Hawaii has a very highly insured population. When you have a highly insured population, what that means is you have people who can access things like, I don't know, disease prevention, preventative screenings, health promotion that delay or prevent a person from needing hospitalization. So when we have a highly insured population, we can keep people from getting really sick enough to need hospitalization. But what that means is we have a whole bunch of care delivery that's happening outside of hospitals in ambulatory, community-based ambulatory settings, keeping people well. We need nurses in those environments. The other thing that I have heard since I started this job is that the acuity of the patients who are being discharged from hospitals is higher than it has been historically. So essentially what we're doing is we're having nurses providing med-surg care to patients in skilled nursing or long-term care post-acute facilities. So where they would ordinarily have been hospital patients, they're now being moved out of hospitals into that post-acute subsector, which again requires us to develop the RN workforce in post-acute settings. When you have more nursing care being delivered before hospitalization and after hospitalization, you shrink the share of the workforce that's actually working in hospitals. So in point of fact, hospitals couldn't ever, I don't think, hire the 75% of new grads who really want to work in those settings. But it's not that hospitals don't want to hire new grads. It's that they have different workforce needs. They hire a smaller share of the entire RN workforce than they have historically. This is Hawaii's data. This is from our supply survey going back to the very first year that we ever collected it, 2007. So in 2007, 62% of registered nurses working in Hawaii were working in hospitals. We can see that there's kind of stability there through 2011. I don't know what happened in 2013. There's a weird dip in the data. I can't explain why. That was before my time. Maybe one of you can explain it maybe. But since 2015, we've seen a very steady decline, which I think is correspondent with the shifting in where care is being delivered. So hospitals having needs for specialty nurses, which new grads are not prepared to do. New grads are trained and educated to be generalists, and they have foundational fundamental nursing competencies, and those specialty competencies come with experience and practice that you get predominantly while working. So if a hospital needs to hire an ICU nurse today, a new grad isn't going to get the job done. So hospitals have those competing priorities of, I need a big enough workforce to take care of all the patients, and also I need specific types of nurses. So hospitals are actually hiring an appropriate number of new grads for what they need in the workforce, given where the entire spectrum of care is being delivered. So I think this is one of the really important facts. I gave this presentation, or a version of this presentation, to a about to be graduated class a couple weeks ago at one of our local schools of nursing. The professor emailed me after the fact. She was like, I didn't know that. So I think that there's an opportunity here to help address students' expectations about where they can expect to work, not because hospitals are stubborn or they don't like new grads or whatever. It's just because care is changing. And so we really have to start talking to our new grads about what nursing is in Hawaii. And a lot of it is taking care of patients who aren't in hospitals. That makes sense, right? Okay, so that addresses the question of why are hospitals not trying to hire new grads? The other related question that we get asked a lot, and there's no poll question for this one, is how many locally educated RNs does Hawaii lose to jobs out of state? This question I get asked, I don't know, 4, 5, 6 times a year by schools. The schools ask the hospital association asks us. This is an issue. Nursing education in Hawaii is a highly, highly resource constrained environment. There's a faculty shortage that's impacting predominantly our UH system schools. We have extraordinary difficulty hiring in the community colleges in particular. We also have a very highly constrained clinical education environment. There's not an infinite number of clinical placements, so that we can't just like admit more students. That's just not feasible. So when we are dealing with educating a workforce in a highly resource constrained environment, it is an appropriate question to be asking, are we educating people who are actually going to help contribute to taking care of local people? Because if all we're doing is expending highly coveted, very limited resources just to train a workforce for, I don't know, Washington State, is that something that we should be doing? No, probably not. But there's these very poignant narratives in portions of the nursing environment in Hawaii that seem to suggest that our new grads are being, I've heard described, swooped up, snatched up by out-of-state employers. Here's the reality of what we know about this. We don't have access to the data. The center does not have access to the data that we need to quantify the problem so that we can know exactly how big it is. When we can't quantify the problem, it becomes very difficult to address, but the center doesn't have the data. In order for us to really appropriately quantify the number of students we're losing to out of state, we need to know who those students are. We need to know what happened to them after graduation. Did they pass the NCLEX? Did they get their license? And then did they go to work? And if so, where? The entities in the best position to collect these data, and I say that knowing that they can't collect the data, are the schools. You know exactly, schools know exactly who their students are. And it should be the case that, like, yeah, we can create a spreadsheet or whatever. We'll just keep track of our kids. We get information about whether they passed the NCLEX or not. We can check if they got their licenses. Surely we could also keep track of whether they got a job. But the problem is the schools don't have a way to collect that information. The students would have to report that back to the schools. And I don't know about you guys, but I didn't have any specific reason to go back and check in with my undergrad program and be like, hey friends, just wanted to let you know I got a job someplace. That's not something that alumni tend to do. So the schools, who have the best sort of like denominator to be able to collect these data, have to rely on students to report back to them, and they don't. So, and this, by the way, is an issue that the schools are trying to figure out how to solve, because their accrediting agencies really want to know, hey, are your students getting jobs? Are your graduates getting jobs? It's something the accreditors ask. Schools struggle with answering this question for their own benefit. So they have a vested interest in trying to collect these data, but you can't make a student check in if they don't want to, a former student check in if they don't want to. So we don't have a way to quantify this problem. What we have are really poignant narratives, though. And we have these stories occasionally where a student will be like, I really wanted to stay in the state, but I couldn't find a job. I didn't know what to do. So we hold on to those narratives and we want to quantify the problem on those narratives. But the issue is that what available data we do have are not consistent with a widespread problem. So our best data, which is an underestimate at best, is from 2019. In 2021, we had some technical issue with our supply survey. And so our response rate was lower than normal. So when we had our last time we had a typical response rate, we had enough data to compare the locally educated students who stayed in Hawaii versus the ones who left. And from those data, we found that about 10% of the students who said that they were locally educated, that were living and working out of state 2 years after graduation, within 2 years of graduation. That, like I said, is an underestimate, because the only people who would be in that number would be people who were renewing a license, have ever gotten a license in Hawaii, and who bothered to complete the supply survey, which is voluntary. If, however, we extrapolate the margin of error from the entire supply survey to that percentage, I would venture to guess that that percentage is no higher than 15% of the locally educated grads in any supply survey cycle were out of state. Now, is 15% of 400 a big enough number to be worried about? That's not my call to make. But our best data don't suggest that this is an epidemic. Now, what you guys know may be different. And so I need you to help me figure out how to quantify this problem to figure out how to solve it. However, here's some reality that we also need to pay attention to. Although we cannot accurately estimate the exact number of our locally educated new grads who ultimately leave the state, what we do know from our supply data in 2021 is that new grads who really want to work in acute care, but who cannot wait 6 months or longer to get their first job, have a statistically better chance of getting the job that they want if they leave the state. So we absolutely have schools from out of state recruiting from our graduating classes. We've got hospitals on the West Coast. We've got hospitals in Canada who are recruiting students before they ever graduate, before they ever have licenses, offering signing bonuses. So if you are a student who is trying to get your first job and you really don't want to work in long-term care, ambulatory, home health, or hospice, or other potentially non-patient facing settings, if you want to get a job within 6 months, you can work in any of those and stay in the state. If you look at this first row here where we have the acute care jobs, this is the 50% mark. This is getting up through the first two bars is the percentage of students who got their first job in 6 months or less after graduating. This is just under 50%. If you look at this last segment of this bar over here, this is 16% of local new grads who got their first job in a hospital. 16% of them took a year or longer to get their first job. That's in actual people, it's like 1 out of every 5. This gray bar is they took between 6 and 12 months. So this whole segment here, we're looking at what 46% of RNs who got their first job in acute care willing to wait 6 months or over a year to get their first job. For those students who couldn't financially do that or who needed to work faster, they did one of two things. They either worked in another setting or they left the state. This is a reflection of the comparative unavailability of jobs in acute care. That again is a reflection of where care is being delivered. So it's not a problem to be solved necessarily, right? So this is just true. If you want to get a job fast in acute care, you're going to go out of state. And I couldn't persuade anybody not to do that if that's what they wanted to do. But that's really what the environment we're looking at here is. We need to find a way to quantify this to figure out how big a problem it is. Are we expending coveted resources to educate Washington State's nursing workforce? I don't know. So we need to figure out on a way to develop the data infrastructure for that. But the reality is that there's no keeping a student who really wants to work in a specific setting within a certain time frame from going to where those jobs are. And if they want to work in a hospital within 6 months, those jobs are not necessarily in Hawaii. That is a sobering fact. Okay. This is probably the most depressing piece of data in my entire report, this entire presentation. It wounds me to have to talk about this, but it's important. So the last question, or not the last question, but the last poll question we're going to have is related to how likely are new graduate RNs to leave their current jobs? Now, I put this where I did because we've been talking about where new grads end up working, not in their preferred setting, or they've left the state. So the question is, if you've taken a job that you didn't really want, how happy are you to be there? That's what this data is about. So my question to you is, what percentage of new grad RNs are likely or very likely to leave their current job within 1 year? 10, 12, 24, or 33%? Amy, go ahead and throw that last poll up for us. Amy.
I did.
There we go. There we go. What percentage of new grad RNs are likely or very likely to leave their job within 1 year? We'll give that just a couple more seconds. Okay, Amy, let's see those results. Oh, you guys were a little more pessimistic than reality. In fact, the correct answer is 24%. I'm going to tell you why your sense was correct here on the next slide, but 24% is a lot. That's a quarter, right? It's 1 out of every 4 new grads, indicating having plans to leave their current job. An important frame of reference is non-new graduates. Among non-new graduates, only about 14% of those intend to leave their current jobs, many of which, by the way, are intending to retire. So that includes all non-new grads. All non-new grads includes the entire rest of the workforce, including those at the ends of their career. So a substantial proportion of that 14% are having plans to leave the workforce for retirement, not because of job dissatisfaction. So let's look at the really sobering graph. This is a intention to leave among new grads by their current employment setting, which by the way, may or may not be their initial employment setting, because again, we capture that 4-year span. So the first job you got may or may not be the job you're currently in. So this is your current job. Half. This bar here is our long-term care post-acute, is that long one with the big red section. That represents 51, 52, whatever it is, 52% of new grads working in post-acute long-term care plan to leave their current jobs within a year. Now, for context and timing, we fielded this survey, it's between April and June of 2021. So they would be planning on leaving their jobs by now. But the specific timing, independent of that, what this data is indicating to us is they don't plan to stay. They're taking a job, like I said, that they didn't want to begin with. And their intention to leave that job now creates significant disruption in the post-acute long-term care setting, where a massive amount of care is being delivered and that has a disproportional number of new grads working in it. This is an unsustainable situation. We need to figure out how to address this so that we can improve retention. The other worrisome thing is this 35% in the yellow bar. Now, this is similar to the yellow bars in the other sections, but these are the folks who didn't know. I was on a meeting, I want to say it was Carissa Hawley, I think, who said this on a meeting at one point. She was like, I can plan for turnover I know is coming. So, okay, fine. I can tell you that 50% of your new grads are going to leave within a year of taking their job. And that you can plan for that is one thing. But what you can't plan for is the 35%, the 1 out of 3, who doesn't know what they're going to do. That's almost impossible to plan for. But this is a problem anyway. Even if I can plan for it, surely we can stop it. So what do we have to do? Are we having, again, adjusting expectations? Is there a way for us to improve the practice environment so that the job is more desirable? Or really is it just about violated expectations among new grads ending up working in a situation that they don't want to work in and didn't plan for because they don't see their nursing careers happening in the post-acute long-term care sector? I don't know which it is, but I think it warrants additional investigation because this cannot go on. This amount of instability and the fact that the majority of our new grads are going to be working, not the majority, but about 1 in 3, 35% of our new grads are going to be working in these settings. This is not something that we can leave alone. So we need to, I think, if we're going to spend any time working on workforce development for the post-acute long-term care sector, retention, recruitment is something that we need to pay very specific attention to help resolve this issue. All right. So 2 other things before, just some kind of data related things, fun facts for you about the new grad workforce before we get into any questions or discussion you guys want to have about what we've talked about today. I want to talk about demographic and educational characteristics about the RN workforce. So one of the other questions we get about RNs is, are new grads more demographically representative of the population than are non-new grads? There are a lot of programs that at our universities that have been designed to help support underrepresented students thrive and succeed through nursing programs. In particular, our Native Hawaiian or indigenous populations, there's been a lot of emphasis on helping them facilitate their successful completion through nursing programs and entry into the workforce. So are we making headway? Are these programs having an improvement as evidenced by a better or more representative proportion of new grads reflecting the population than our non-new grads? So I've got 3 graphs I want to show you. This first one here is gender. We have males and females here. This third graph is not reported. There's no population bar because it's not a census category. These data come from ACS, the American Community Survey. We do see that there's a slight improvement in the proportion of men in the workforce among new graduates as opposed to non-new graduates. However, still nursing, I think, is forever going to be a predominantly female profession, but we are seeing improvement. We are nowhere near the 50% of the population who is men though. So there is clearly still room to move to improve on that point. In terms of race, I do have specific ethnicity data also in the report, but that graph was too unwieldy for a PowerPoint presentation. We see some interesting shifts in representation. So in particular, we still have a very consistent overrepresentation of Asian persons, both among new grads and non-new grads relative to the population. But where we're seeing interesting changes is in the multiracial and white categories. So in the white categories, 27% of non-new grads are Caucasian, which is slightly overrepresented as compared to the population. 3 percentage points, not a huge overrepresentation, but still a few more white nurses in the population or in the workforce than there are white people in the population. Among non-new grads, though, we're seeing a significant drop off. So we're underrepresented in the Caucasian subset among new grads. We're seeing, I think they're being occupied by the multiracial. And so we calculate that in the same way that the Census Bureau does, that if you indicate more than one racial category, you categorize as multiracial. So here we're seeing a growth in the multiracial subset of the new grad workforce, which is an overrepresentation as compared to the population. Whether this is a good thing or a bad thing, I mean, anytime you have a mismatch between the workforce and the population, we're unrepresentative. So just because we have more multiracial people in the workforce doesn't mean that we're making an improvement necessarily, because we've shifted into a different direction of unrepresentation. So I do feel like this is something we need to monitor. And the population will continue to shift. So I don't want to draw any conclusions about this, but it is interesting to note. In terms of our Native Hawaiian population, we categorize anybody who indicated that they were any part Native Hawaiian as Native Hawaiian. The population data does include Native Hawaiian and other Pacific Islanders, but predominantly are accounted for by Native Hawaiian persons. We, again, are seeing an optimistic improvement in the representation of Native Hawaiian persons among new grads. So 12% of the non-new grad RN workforce versus 17% of new grads are Native Hawaiian. Again, this is an improvement. We still have room to go to get to that quarter of the workforce that is Native Hawaiian. So we are doing a bit better on representation, but we do have room to work. And I think all of the various efforts to improve representation at our schools of nursing will eventually trickle into the workforce over time. The other question we get about new grads is in terms of their educational preparation for a nursing practice. Do most new grads enter practice with a BSN? The answer to that question is yes. This blue segment here, the 9%, is the graduate entry nursing program folks. So those ones who do the accelerated RN and then do a graduate degree in nursing, they're 9% of new grads, and then 62% are baccalaureate prepared. This is not surprising. Since 2017, Hawaii has had one of the most highly educated nursing workforces in the country. We have 8 schools of nursing, and the baccalaureate programs, the baccalaureate granting programs in aggregate produce more students annually than the ADN programs do. So this is entirely unsurprising. As a result, our current BSN preparedness rate at the state among RNs is 74%. Oahu is at or over 80% because most of the baccalaureate granting schools are on Oahu. Where we're seeing a challenge in getting to 80% as a state is that we have 2 counties without entry to practice baccalaureate programs. Kauai County and Maui County do not have BSN programs on site. Maui College is working on that as we speak, trying to convert the ADN to a BSN to improve the baccalaureate preparedness rate on the neighbor islands. But as a state, we are doing very well, but we already have identified those places where we need to make improvements. So that's the educational characteristics of the new grad workforce. So we're coming to the point where I want to wrap up so that we have some time for questions and discussions. If you guys have thoughts you'd like to share, I hope that you do. But my key takeaways that I hope you come away with today is that there are indeed jobs in Hawaii for new grads. Most of them are non-acute settings where new grads prefer not to work. So although we have job availability, we continue to have recruitment and retention issues that we need to figure out how to work on. That greater job availability in non-acute settings reflects an overall shift in where healthcare is being delivered. And it's not a resistance to hiring new grads or whatever. And as a matter of fact, I want to make the point that hospitals since at the end of 2021 and beginning of 2022, have done an unprecedented amount of new grad hiring in response to the current shortage. Like COVID wreaked havoc on all kinds of things, but because people delayed care, made people sicker. So we had more patients in the hospitals. And so in response to that, hospitals are doing an unprecedented amount of hiring. I don't know what their anticipated hiring is for the cohort of kids that are graduating like last week. Not sure what it's going to look like for hiring at the end of 2022, but we are seeing a great increase in the amount of new grad hiring into hospitals in the last year and a half or so. But that doesn't change the trend that overall more care is being delivered outside of hospitals. And so what we're going to continue to see is that probably the majority of jobs available for new graduates are going to continue not to be in hospitals. And we need to figure out how to help new grads not only understand that that's the case, but to help embrace the idea that nursing care is not just about being in a hospital anymore. We get that it's an issue, it's a problem, it's a thorn in the side of the education programs that their students leave to go take jobs in other places, that they're aggressively recruited by out-of-state facilities. But the problem, we're having trouble quantifying that. So we don't know exactly how big a problem that is. And when you can't quantify the size of a problem, it becomes difficult to place it appropriately in the prioritization of problems you want to solve. So we could figure out how to develop a way to collect these data to accurately, or at least get inside a ballpark of how big a problem this actually is, we can pay it more appropriate attention. I also think it's worthwhile to figure out, like, what can we do about other states recruiting our nurses? Like, that to me is an issue we should be talking about as well. It's worrisome to me that more than half of new grads working in long-term care plan to leave their jobs within 1 year. We need them there. We need them happy there. We need them willing to continue to stay and provide that important nursing care to that subset of patients. We got to figure out how to solve and address that problem to the best of our resources allow. And new grads are only slightly more demographically similar to the state's population than non-new grads. So even though there's an improvement, there is room for more. Those are the highlights. If you want more information, we do have an entire report on this. It's about 12 pages of me talking to you about the data. All the data that you saw today are in this report, with accompanying explanation. There are also additional data in the report that I didn't squeeze into today's presentation. So if you haven't taken a look at that report, I would encourage you to do so. We also created a 2-page infographic. This is the first page of that infographic. Both of these are available on the Center for Nursing's website. Like I said, we'll be sending out this slide deck with the evaluation at the end of the presentation. So you'll have the link, but if you just Google Hawai'i State Center for Nursing Workforce Reports, you will find all the goodness that we make available for you. As a reminder, you will need to complete an evaluation if you want to claim continuing nursing education for the participation in this activity. For people participating today, as opposed to watching the recording, you must complete the evaluation by 11:45 p.m. on June the 7th. The link will be sent by email from hscfn@hawaii.edu. If hscfn.hawaii.edu is not on your contacts or list of safe senders, please add us to your contacts. What we don't want to do is you missing the opportunity to get your C&E because our email went to your spam. So I highly recommend that you save us to your book. If you happen to be watching the recording and you want to collect C&E for participating as an enduring participant, the link will be available in the description of this event down below. That's it. That's all the words I plan on saying today. Unless you have questions for me, you can get in touch with us by email, on the internet, on the socials. Come see us. Actually, call me is a better way to do that. That's all I got. So mahalo so much for your participation and listening. What questions do you have for me, if any? Better pay too. I think this was in reference to the desirability of, thank you, Catherine, for posting the link. And I saw your comment just now about better pay too. That's actually a fact. And I didn't talk about that in this presentation, but I allude to it in the report. We collected salary data on the 2021 Nursing Workforce Supply Survey, and we asked people to provide the range of their salary. And then in response to a request from a meeting that we hold on a periodic basis with our chief nursing officers, somebody wanted to know what the salary differential between acute care and non-acute care was. I don't remember it off the top of my head, so I don't want to quote incorrect numbers to you, but it's huge. So there is absolutely more challenging characteristics about the post-acute long-term care environment, and also you get paid less money to work in those settings. And so if you're talking about, I have a priority to go to work because I have to pay off these student loans that I took out to get this degree, to get this job, it makes sense to go with the most bang for your buck on where am I going to work that I can make the most money, and long-term care is not it. So there is actually a link to a spreadsheet where we do that cost comparison of the salary compensation comparison in the new grad report. So it might be of interest to you folks to take a look at that. Any other questions? Comments? If you just want to pop open your mic and contribute, you don't necessarily have to throw anything into the chat. I was expecting people to be annoyed by some of this content. No? That's okay. You can send me annoyed emails later. I mentioned, I'm getting a direct message to me. I mentioned about the shift in nursing care out of the hospital into other facilities. I'm curious How is the salary in other facilities compared to hospitals? The salary comparison includes all of the 5 setting categories that we group the settings into. So we end up with very small cell sizes if we report all the settings we collect data on. So we roll them up into the 5. So we have acute care hospitals, which includes critical access hospitals. We have post-acute long-term care, which includes skilled nursing, assisted living, nursing homes, and rehabilitation hospitals. We have ambulatory, which includes any kind of clinic setting or outpatient setting, including surgery centers. We have home health and hospice, including inpatient hospice, and then all other settings include anything that's not in those categories. So the salary comparison that we provide uses those 5 categories of settings, and it provides the comparison across all of them. So I would encourage you, if I find it, I will link it. I'll help. Amy is going to send the evaluation, but I'll make sure that she has the links to the slide deck and that salary comparison, since it seems people are interested in that. So let me make sure you get it. Hi, Anne. I see your beautiful face.
Yeah, you're so great. How you got so smart already?
Oh, I went to school for a really long time.
Well, thanks for spending it on Hawaii. That's just incredible stuff. I think whoever brought you to their class did a really good thing. And I think we need to do more of that. The students, you know, coming in, this is a really competitive group when they come in, and they got to know the reality of what they are and how service to their community is going to look, and plan their career with that in mind, not just like, I'm going to be in and go into a hospital.
And I think that one of my very, very favorite requests that anybody ever makes of me is when a professor asks me to come talk to their about to be graduating students, because I have this presentation, I use the most up-to-date data, and we focus on what they can expect when they go out into the workforce. So it's just, you know, it's a little late. I feel like, you know, the last day of class, it's probably too late to be giving that presentation, but at least the students have an opportunity to know what they're about to walk into. So I will come. You want to fly me to Maui, Anne?
Yeah,
I got you on
get
that.
you on Maui just like this, but flying you to Maui has some great ideas surrounding
either
that.
way, I will talk to any school who wants me to come talk to them. So
well, we got a group this summer, and they're going to start second year next year. And I think even, you know, the mindset is important to make them feel successful.
I agree with that.
They're in control, like they have some choices.
Yes, it's that feeling like I took this because it's all that was available to me. If we can shift that mindset earlier on in their education, then you're right. It feels like a choice that they made.
Right. How we're supporting the community.
Agreed. We'll talk. You let me know when you want to come talk to your students.
I got this calendar. I'm going to find something to happen this summer.
You let me know.
Yeah.
You let me know. Okay. I'm a nurse manager who has hired many new graduate nurses. They need to learn how to interview for jobs. That's great feedback for our education programs. I know that some of the schools do mock interviewing. So that's a really important skill. Is there something specific that they're failing at in the interview? That would probably be helpful for our schools to know. So is there some element of the interview in particular that we can improve upon? Ruth, if you want to open your mic and let me know, otherwise you could drop it in the chat. Either way is fine for me.
Hi, it's Ruth.
Hi, Ruth.
Can you hear me?
Yes.
So I've been a manager for about 20 years, and when they interview for jobs, they either come off overly confident, too sure of themselves, or they just don't know how to market themselves.
I think that's probably something that we could work on. There's a way to work on that. That's really good feedback, I think, for the schools who are on the line. So thank you for that information. If we wanted to follow up with you more on that, is it okay if I holler at you by email?
Certainly. Catherine reached out to me because I've worked with her before.
Okay,
but I'm
great.
glad to give feedback. Yeah.
We're all about making connections here too. So thank you for that feedback. Super useful. Carolyn asks, would it be helpful to have the reality check for during the first semester? So yeah, Carolyn, I think that you're in agreement with my thoughts that the last day of class is probably a little bit too late, and we really need to start earlier on planting the seed that you have an opportunity to take care of your community if you think about nursing as happening in places other than hospitals. So I do agree that the earlier I have a chance to talk to the students would be great. So anybody who wants me to, again, let me know. What are the chances that a new grad who has 6 to 12 months of LTC experience getting hired at an acute care facility? That's a great question. There's a belief that once you go into long-term care, you're stuck there because the settings are so different or whatever. But I have a hard time with that one, because if it is the case that the patients in long-term care are high acuity, then is it really that much different to provide care in long-term care than it is in acute care? But that's a question for the acute care facilities. I don't know if anybody is here from acute care who can comment or is willing to comment on that, and maybe not. I don't know if you don't want to publicly, but if you want to slide me an email, I think that's a really important question. And it contributes, I think, to new grads' reluctance to accept a job in long-term care if what they really want to do is like, I want to be a critical care nurse or an L&D nurse. You have to do that in a hospital, right? And so if you think that taking a job in long-term care is ultimately going to undermine your long-range career goals, that's a problem. But maybe it's not. I have hired many with LTC experience. Thank you, Ruth, for that. So I don't know. I think that that's a good question we should be asking acute care facilities. I think the Center for Nursing can do a better job of systematically acquiring those data, so we can answer that question. I'll talk to my boss about that. Any other questions from our fabulous audience today? If not, I am always available for talk story about these data. If you take exception to some of the data that I provided today, I really definitely want to hear from you. Can we collect it better? Can I interpret it better? All of that. You all help me do my job better. And thank you so much for giving me an audience to be able to share and disseminate some of the data that the Center for Nursing has found. I appreciate the opportunities to do this. At this time, I'm going to go ahead and close us out. Thank you for your participation. Have a fantastic week, everybody. Mahalo.